technically size doesn't really matter. Physiologically, this is the most sensitive portion, so you don't have to have that long of a penis to make a difference, or hand, or dildo, or whatever. Okay. This is what happens inside the vagina during arousal. We'll talk more about this when we talk about orgasm. The clitoris becomes erect. Again, we talked about the clitoris being a small penis. And the clitoris actually pulls its head underneath the hood like a turtle, which I think is funny. The labia engorge. The vagina lubricates, and the uterus rises. During the plateau stage, which is the stage right before you might achieve orgasm, the clitoris retracts into the hood like a little turtle. The vagina engorges. So this is when we talk about studying arousal, and we'll look in a second. All the blood flow goes to the vagina, and it becomes swollen. The upper part of the vagina expands, and lubrication continues. This is the photocell that's used to measure female arousal. So anytime you read data, especially if you're reading in Psychology Today or something, and you're reading about what makes women tick sexually, what turns women on, they're usually using something like this to study that arousal. So this is about the size of a tampon. It's clear. It was invented first by Masters and Johnson in the 1950s. Has a camera and a light in it, and it takes pictures of the color of the vagina. As the vagina becomes more aroused, blood flows to it, and it goes from being a pink or red color to a dark purple color. So that's pretty much the entirety of how we study female arousal. So what are we leaving out of our studying when we use this and this only to study female arousal? We just talked about it at length. Yes?
The rest of the body.
Yeah, the rest of the body, especially the clitoris, right? So no one has developed a way to actually measure clitoral arousal. So if you want to make $1 million, figure that out. A moment about lubrication. We're going to talk about lubrication in this class a lot, especially when we talk about anal sex. Lubrication is very important, especially when you are experiencing penetration. So the person being penetrated should decide if whatever hole is being penetrated is lubricated enough. That's very, very, very important. If you are the penetrator, follow the penetratee's lead. Your opinion does not matter on this. So, if someone says it's not wet enough, or we need lube, or it's too dry, or just looks maybe possibly uncomfortable, it could be a kind of lubrication problem, do not say, oh, it's fine. I don't know if you all have experienced this, but this is very few things make me feel rage. And one thing that makes me feel rage is when I have said, it's not wet enough, and then the guy is like, oh yeah, it is. I immediately want to smack you in your mouth and kick your penis out of my vagina and make you walk home naked. That makes me really angry. So, and it definitely snaps you out of an arousal stage, right? So you just need to constantly be checking that whatever penetration is going on is lubricated enough, and you need to be checking in with the person who's being penetrated. And we talked about why people might potentially be silent or be frozen and not be able to express themselves. So that's something that you need to be aware of. Because if there's not enough lubrication, what can happen? Okay, so skin can tear, right? That's not sexy, that's not hot, that's not comfortable, that doesn't feel good. What else can tear? Condom, yeah. So you really need to make sure, and we'll talk about this more next week when we talk about STIs, that condoms are lubricated, not on the inside, but on the outside, because they can tear, right? And that would be unfortunate. So, finding the G-spot. Who knows who the G-spot was named after? Dr. Grafenberg, who's the male doctor that found the G-spot, which I think is really funny. So, some people say the G-spot does not exist, other people swear by it. You can find out for yourself. The G-spot should be, if you're looking for it, about 1 inch to 1.5 inches inside the front wall of the vagina. And you can use what lesbians call the come hither motion. Like you're saying come hither to someone. That's the lotion, That's the motion that you want to use. Don't use lotion on your phone. We'll talk more about lubrication, but really quickly, what kind of lubrication do you want to use? water-based, right? You always want to use water-based lubrication. Why is that? What can oil-based lubrications do?
Eat through condoms.
Yeah, they can eat through condoms. So you really don't want to be using an oil-based lube. You won't want to be using like olive oil or grapeseed oil or something like that. Unless, I mean, it's not bad for your vagina to use some sort of organic oil. But you don't want to use oil-based lubes if you're depending on a condom. Or silicone-based lubes, because silicone-based lubes, you really only want to use those with silicone sex toys. So it's easier just to stick to water-based lube and use it liberally. Anyway, so here's the G-spot, you can find it. Here's the come hither motion that you would use. And we're gonna watch a little video. How many of you are aware of Sex or Sandra? Any of you? No? She's really funny. Uh-oh. Is it gonna do that thing where it does twice? No, it didn't do it. Great. Okay, here's Sex or Sandra explaining the G-spot.
Where's the G-spot? Where is it? How do you find it? Those are very good questions. I will tell a group of 100 people how to find the G-spot, and half of them still look a little confused. It's really simple, but you always have to remember to go toward the belly button. Take Brunhilde, for example. Here's her belly button. Okay, let's just say. So if she's on her back, I'm going to put my fingers about an inch in and go up toward the belly button. Let's say Brunhilde likes doggy style. Down toward the belly button. Oh, she likes sideways. What? She's crazy. Toward the belly button. So it's just an easy way to remember which way to put your fingers in. Also helps to remember where the prostate is, since magically we all have this really exciting spot in our bodies that's fun to touch toward the belly button. So, anyway, that's that.
Okay, that's Sex or Sandra. She has a podcast. This is a quick demonstration of how to stimulate the G-spot.
After your partner is thoroughly aroused and relaxed, insert your finger up to about the second knuckle
And not knowing his dishwashing gloves on.
and your wall. There, after some stimulation, you will feel her urethral sponge engorge and become firm. Use a forceful, high-pressure thrusting motion, and eventually, towards the top, you'll feel a little bulge. That is G-spot. Apply firm pressure, and if you're lucky, she might just have a G-spot orgasm. Good luck, and let me know how it goes.
Okay, so he says apply firm pressure. Be gentle at first. If you have little hands like this size, you can use like 2 or 3 fingers. With big hands, start with 1 finger, maybe 2. But don't just like, rah. Start off slow and then become more firm. But once everyone's comfortable and all is well, it really can take some like forceful, what he was doing, and you can have an orgasm that way. Does anybody have any questions about the G-spot? Okay. So the reproductive tract. Again, this is the vagina, this is the cervix, this is the uterus, these are the oviducts or fallopian tubes, and these are the ovaries. These fibria are the finger-like structures that actually, the ovum actually erupts out of the ovary, and the fibria are what bring it into the fallopian tubes. So, this is the demonstration, or the picture from the guy getting it on. I think it looks like a car from the Jetsons or something. But as you see, here's the clitoris. It looks like a wishbone. So hysteria, as we're talking about the uterus. Has anyone ever heard of the play In the Next Room, or the vibrator play? Best play ever. Go see it if you have a chance. I think they might be making a movie out of it called Hysteria. I'm not sure. So when I say hysterical, what does that mean? When I say someone's hysterical, what does that mean? Crazy or upset. Do you think of is it like gendered? Like, do you think male or female when I say hysterical? would I be more likely to describe a woman or a man as hysterical? Usually it applies to women. It has a long history as a diagnosis. So it comes from the word hysteria, meaning room. Hysteria was a medical diagnosis for hundreds and hundreds and hundreds of years. And basically doctors used it to diagnose any problem that a woman had. So choking, breathlessness, palpitations, faintness, weight gain, weight loss, too much or too little interest in sex, insomnia, excessive sleep, muscle spasms, depression, irrational fears, and more. So basically, if you were female and you went to a doctor and you had pretty much any complaint, besides like I broke my finger, they diagnosed you as hysterical. Since the male body had no uterus, their concept was that the uterus floated around the female body, causing havoc. This is kind of another symptom of that whole approach to medicine, which was we'll study male bodies and then we'll just pretend like it applies to female bodies and or make up things. But the female body was just not really studied until fairly recently. So this is a funny doctor quote about the uterus. It is very much like an independent animal within the body, where it moves around of its own accord and is quite erratic. Furthermore, it likes fragrant smells and moves toward them, but it dislikes foul odors and moves away from them. When it suddenly moves upward, it remains there for a long time and presses on the intestines. The woman chokes in the manner of an epileptic. So this is kind of the concept of the uterus. And this quote was a really long time ago, it was from the 2nd century. But this basic understanding did not change until literally the 1800s. So you had hundreds and centuries where everything was just kind of chalked up to this uterus that was wreaking havoc in the female body. So what do you think was the cure for hysteria? It was called the release of uterine fluid, which is an orgasm. So you would go to the doctor, and you were depressed, or you had backache, or you had whatever, and they just diagnosed you as hysterical. And then the doctor would prescribe treatment, and that treatment involved manual stimulation of your genitals until you had an orgasm. And then magically, you felt better. And so doctors were literally giving these treatments repeatedly. Sometimes they would literally prescribe like 2 to 3 times a week, like come in, pay me, and I will rub one out for you. And they gave it a fancy technical name, and that's what it was. Women generally were not having orgasms at home, right? So they were kept ignorant of their own bodies. They didn't know what was happening. They didn't know how to do it themselves. They were not having good sex with their partners. Nobody really even understood the concept of female orgasm. So this was like a big deal, right? Like you would go to the doctor to get this treatment, and you would magically feel better. You weren't depressed anymore. So doctors became very busy and overloaded, as you can imagine, with women who needed these treatments. So they actually were the first to invent vibrators. So a vibrator, this is an example of one of the first vibrators, hooked up to the wall, very dangerous. And they could literally, like, they could turn, patients over a lot faster because they could use a vibrator in their clitoris and get you to come in like 30 seconds as opposed to 30 minutes. So you can thank doctors for inventing vibrators, and that's really interesting. Anyways, so if you go to the doctor now, they will not do that for you, most likely, but they might give you a pap test, which you should be getting regardless of whether you're sexually active or not. They use a speculum, which is this little instrument that looks like a duck, and it opens the vagina, and they take a really long Q-tip and swab the mucus on your cervix, and put that mucus underneath a microscope and look at the cells to see if there are any precancerous cells. Don't freak out if you get an abnormal pap smear result. 4 out of 5 women get it. They might find